Hi, welcome back to another episode of Seco Direct. My name is Dr. Tewa, and to continue with this series about being proactive with your health, we have done routine blood tests, we've done routine physical exams. For today, we are going to go into routine imaging tests. Now, routine imaging tests are very, very crucial in preventive care. We have some examples of these imaging tests. Imaging tests such as mammograms, X-rays, computed tomography scans. So why are these important? So these routine imaging tests, they're usually in this routine test, they're known as diagnostic imaging because they are medical procedures using different technologies to produce detailed images of the inside of your body. Now, these images are very crucial in diagnosing and monitoring your health conditions. They can check if you have any broken bones, any masses, any tumors, any infection in your body. These are very high grade level exams. Now, the most routine imaging test that is very popular around is called the X-rays. Now, this X-ray is a well-known imaging test, and they are usually, if you go to your healthcare provider, they usually need you to undress and put your chest to an X-ray so that you can evaluate your chest, for instance. So this X-ray, we have a chest X-ray. And for this chest X-ray, it's usually done to check if you have, for instance, if you have some fluid in your chest, if you have increased air in your chest. These two things mean different things. Now, if you have fluid in your chest, it could mean that you have what is called hydrothorax, water in your thoracic cavity. And if you have increased aeration, it could mean you have an infection, for instance, like a pneumonia, for instance. So you would usually have some symptoms before you do the chest X-ray. Symptoms maybe, for instance, if you have the pneumonia, you could be coughing, you could be sneezing, for instance. So this X-ray is usually the bottom baseline of imaging tests that can be done while you come in for your routine imaging test. Other routine imaging tests, which are more higher level in terms of their specificity of diagnosing the medical condition that you might have, include the computed tomography test, which scan, which is the CT scan, the magnetic resonance imaging, which is the MRI, and then the mammography. I want to touch on the mammography itself because the mammography is a really important imaging test. It is usually done to diagnose, for instance, breast masses or to check if there's any sort of cancerous tumors in your breast. So I would advise that you do this mammography at least two times in a year. Now, because of the radiation involved when you are doing some of these routine imaging tests, it is usually advised you do this routine once or twice a year, because it is usually contraindicated in some conditions. So, for instance, if a patient is pregnant, it's usually advised not to do too much of radiation routine imaging. So it usually depends on your medical history, your age, your gender, or any specific health concerns that you might have. Always make sure to inform your healthcare provider so as to keep them in the know for what would be required for you at that particular time. Also inform them of when last you had done this routine imaging test. Another routine imaging test that I just want to quickly touch on is called the colonoscopy. Now, this colonoscopy involves passing a tube through your anus to visualize your gut. Now, it might sound a bit scary. A tube through my anus. Why? What's going on? It is scary in theory, but practically it usually takes about 20 to 30 minutes. They just want to check through to see if you have any masses in your colon, in your anus, maybe hemorrhoids, for instance, to check if you have any tumors. Also can also be a reason why this colonoscopy can be done. Now, in the inverse of that, we also have what is called an endoscopy. Now, the endoscopy is the tube doesn't pass through your anus. This time it goes through your mouth. Now, what does it visualize? We have patients that might have gastric ulcer, that might have peptic ulcer, duodenal ulcer. This test helps to visualize that. Now, endoscopy is not only the imaging test that we would need to do when it comes to gastric ulcer or duodenal ulcer. It's the gold standard, but there are also other tests that can be done in terms of imaging. But in checking for endoscopy and what it entails is to pass that tube through your mouth to check if there are any occlusions, for instance, in your esophagus, gastric ulcer, and duodenal ulcer. Now, as I've said, this routine imaging test can provide very valuable information and make sure that you get ahead and be proactive in terms of your health status. It helps to at least piece the puzzles together. You always have to know that when you're doing a routine imaging test, it's not like you're going there looking for something. But if you even find something, it is good that you found it in a routine medical test, because that would mean that you do not have any ailments. Because people usually have this misconception that for you to go for all these tests, you need to at least be sick or be ill. But that's not what we want to encourage here. We want to encourage you to be proactive in terms of your health status. Always get ahead and make sure that you are in front of anything that might occur. And if nothing occurs, live life the way you have been doing it. Exercise, have good sleep, do what needs to be done to continue the clean slate of health that the routine imaging tests have confirmed. That's all for today's episode of Seco Direct. Thank you very much for listening to us. And if you have any questions or any comments, make sure to put them in the comments below. So subscribe to Seco Direct as we bring in informative, insightful discussions regarding your health status. So don't hesitate to contact your healthcare provider if you have any questions or any concerns. But until next time, I'm your host, Dr. Tewa. Take care and stay well.